standing. Put it back in session. You may be seated.
All right, Mr. Brennan, your first witness, please.
Thank you, Your Honor. The Commonwealth calls Timothy Nuttall.
Raise your right hand. You solemnly swear the evidence given to the court and jury in the case now and hearing should be the truth, the whole truth, and nothing but the truth, so help you God.
Sir.
Thank you. You can take the seat.
Sir, could you pull the microphone down a little bit closer to you, please?
Yes, sir. Or yes, ma'am. Excuse me.
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning.
Good morning, sir.
Could you please introduce yourself to the jury?
So my name is Timothy Nuttall. I'm 28 years old. I've been a firefighter paramedic for ever since I graduated high school. I graduated in 2015. I took my EMT class and got my certification while I was actually still in high school. From there, I moved on to the BLS transfer side of EMS. There's 911 EMS, and then there's transfer, which is basically back and forth from hospital to hospital. I was brand new and very young, so I started on the transfer side, kind of learning the job. I started primarily in the city of Chelsea, Everett, Malden, Somerville, up there. And then after a little while, I got my feet wet in the 911 side. So I was running BLS 911 in those cities as well. And then I progressed on to become a paramedic. So.
Why do you have such an interest in being a first responder at a young age?
I kind of grew up in a first responder household. My father was a firefighter in a local town, so we spent kind of a significant amount of time at the station when he was on shift. It's just kind of how I grew up, kind of learning the ins and outs of public safety. That's just kind of how I came to be interested in the profession, and then I took it from there. So.
I want to take us back just a little bit. When you first became interested in training to be a first responder, did you share with us your first training was as an EMT?
Yes, sir.
Can you share a little bit with the jury what that entails?
So to become an EMT, there are two sides of EMS, and then there are two sides of providers. There's EMT basic, and then there's paramedic. To answer your question, sir, to start as an EMT, it's about a 4-month process. You take classes. I believe mine was Tuesday, Thursday, every other Saturday. Learning just anatomy and physiology, basic pharmacology, and kind of how medications interact with the body and different disease processes. From there, you start learning basic interventions, backboarding, C-collars.
As part of your work in learning to be an EMT, are you active in the field?
The initial training is, that's mostly classroom-based, but once you sit your national written test and you're able to pass all that and pass practical, then you're able to progress into the field.
And did you succeed through the EMT training?
Yes, sir.
At that point, did you decide you wanted more training? You wanted to proceed through the profession?
Yes, sir. So after a little while, I worked for about 1.5 years in the field and decided that I genuinely enjoyed the work that I was doing. I then made the decision to progress to the paramedic level. That's a significantly more challenging academic portion. And
can you briefly share with us a little bit of the training that you needed to complete to be a paramedic?
Yes, paramedic training is about, I would say, generally takes people about 2 years to complete. There's about 1 year of classroom. It delves far deeper into not only diseases, but how they interact with multiple body systems, multiple different treatment modalities that we can pursue, multiple different interventions, a whole host of medications, far more medications than a BLS. As a paramedic, I have a much wider range of drugs that I would be able to select to treat different patients.
As you worked through your training and got this experience, did you ultimately become employed by the Canton Fire Department?
Yes, sir.
What did they hire you as?
They hired me as a firefighter paramedic.
And so you were both a firefighter and a paramedic.
Yes, sir.
Does the Canton Police Department, in their units, do they include paramedics and firefighters in the same division?
The Canton Police Department or the Canton Fire?
I'm sorry, the Canton Fire Department.
Canton Fire Department, the vast majority of the employees of the Canton Fire Department are paramedics. I believe there are I want to say 5 EMTs, but now as a requirement to remain employed by the Canton Fire Department, you have to become and maintain a paramedic certification.
So when you would go to work as a firefighter or paramedic, was it always the same, or did you get assigned as a firefighter one night and a paramedic a different night?
So we would cross-man trucks. We were always fire suppression personnel, but we were also cross-trained as paramedics. So, for example, if a fire call were to come in the town of Canton, and I was assigned to Ambulance 1 for the day, I would take all my equipment off Ambulance 1, and I would transfer it to Ladder 1, and then we would take Ladder 1 to the fire call and operate as fire suppression personnel. If a medical call were to come in, I'm assigned again to Ambulance 1, then we take on the role as EMS. I take my paramedic skills and put them to work in the town on Ambulance 1.
Let me ask you one more background question about how the Canton Fire Department works. When there's a call, an emergency call, is an ambulance sent with other vehicles or alone to the call?
Yes, sir. It's typically an engine, the engine of that district, and the ambulance of that district. Depending on call volume, that can change. But if all is not to use the word quiet, it's kind of a taboo word, but if all is everybody's in quarters, and there's a dispatch in District 1, it'll be Canton Engine 3 and Canton Ambulance 1, and they go as a unit together.
Mr. Nuttall, I want you to take us back, if you would, to the early morning hours of January 22nd, 2022. I want you to bring us a little bit before 6 a.m. Do you remember what you were doing?
Yes, sir. So that particular morning, I arrived at work earlier than I normally do. There was inclement weather that morning, so I left earlier than normal just to get in before the roadways got particularly difficult to travel, and to relieve anybody that may need to get out if they needed to get home before the roads got particularly bad. I arrived just before 6 a.m. I was walking in. I was assigned to Ambulance 1 for that oncoming 24. I was scheduled to be there at 8 a.m.
Could you share with us a little bit about how the weather was as you arrived around 6 a.m.?
It wasn't great. I was driving. It's about a 35-minute ride for me to get to Canton. The roads were starting to get. They weren't great. They had been treated, but they weren't pristine. The wind was starting to pick up. The snow was starting to come down a little heavier, which is the reason that I left at the time I did.
And so I may have misspoke. January 29th, 2022, that morning, around 6:04, did you hear a tone or did you hear an alarm?
So the tones went off right as I entered the building.
Tell us what a tone is.
So the tone is the emergency alert tone. In the town of Canton, we have 3. We have 1 for fire, we have 1 for investigation, and we have 1 for EMS. The EMS tones went off and the lights came on. Whenever the tones go off, the lights come on as well. I was just walking into the building when the tones went off and the lights came on.
And is there information that accompanies the tone, information about the call that needs response?
Yes. So after the tones had cleared, there's an overhead dispatch, which is our dispatch center, communicates to us before we get in the trucks and on the air responding, basic nature of the call. In that particular instance, we were dispatched to an unresponsive male in a snowbank with no real further information to follow up on.
So what do you do?
That truck, and it was firefighter paramedic Anthony Flamati and firefighter EMT Matt Kelly. Matt Kelly has since become a paramedic, but at the time he was an EMT. So off the bat, that crew, not to say that they were at a disadvantage, but paramedic Flamati was the only paramedic on that
So
ambulance.
what did you do?
So I made the decision. I checked with the shift commander, and I jumped on ambulance 1 to just give a second set of hands as being a paramedic myself, just being able to hopefully help if there was any advanced interventions that needed to be done or needed to be performed.
What
And
happened?
just a second set of hands.
What happens next?
So I got in the back of the truck. I was actually still in civilian clothing at the time because I had just walked in the door. So I got in the back of ambulance 1 in the patient compartment. The other 2 gentlemen were up front driving to the scene. I actually had to don my turnout gear because, again, I was in civilian clothing. I wasn't quite ready to go. So I had to put all my structural turnout gear on and then my can fire jacket. Once I was sufficiently dressed for the call, I started prepping all the gear that we might need for a call such as that, for an unresponsive male in the snow. In this case, it was our first in bag, our airway bag, and our cardiac monitor. Everything was all together. They were all in 3 separate bags. But on the way there, I just got in. I didn't know how their night had gone, so I just took a real quick look at everything just to make sure everything was there, and everything was exactly how it needed to be. So I was able to just grab all 3 bags, put them on my person, and get ready to, so as soon as the ambulance was on scene, just step off and go to work.
Not knowing much information about what you're going to confront, what goes through your mind as you prepare before you get off the ambulance?
Just basic scenarios. I mean, again, unresponsive male in the snow could mean several things. Not having much to go off on the dispatch was, it left much to be desired in terms of what we might need. So in gathering all the equipment together, it can kind of cover all the major bases, if you will, in terms of what we were expecting to meet once we got on scene.
How was your focus before you get off the ambulance?
I was ready to go. A dispatch like that, any unresponsive male in the snow, it can kind of up the level because you just don't know what you're walking into. You know, it could be anything.
In the back of the ambulance, you can't see outside. Could you tell anything about the weather conditions based on the way the ambulance was moving?
Again, being in the back, as you noted, it just seemed to be taking a little bit longer than normal. I really had no visibility at all. Like I said, I was in the patient compartment. It's very limited visibility in the back, and it's limited visibility. There's like a peephole that's maybe 1.5 feet by 1.5 feet to kind of peek up front. But again, I was so busy getting everything together, I really didn't notice. But I did note it took a little bit longer. We were going not slow, but we were going cautiously.
When the ambulance finally stopped and the doors open, tell the jury what you see.
So as I mentioned, I had the 2 bags and the cardiac monitor, so 3 pieces of equipment with me. And I stepped out of the back or the side of the truck. There's a back compartment, or a back door, and a side door. I stepped out of the side door. And I immediately noted the wind had picked up and the snow seemed to be heavier. And I could hear like a distant screaming off in the distance. Wasn't exactly sure where it was coming from.
What was the visibility like?
It wasn't great. It was still dark out. The sun had not come up yet. The snow was coming down, as I said, heavily. And it wasn't great all around.
Was it cold?
It was cold. Yes, sir.
It's when you hear the screams, what do you do next?
I started making my way kind of towards the sound, following the sounds. I couldn't see anybody yet. So I just kind of followed the sounds. And then once I was able to get around the side of the truck, that's when I was able to see a group of 3 individuals with Canton Police. And I started making my way over to them to see where the patient might be located and what was going on.
As you get closer, tell us what you see.
So as we approached the scene, as I said, there were 3 individuals, and Canton Police were on scene as well. And then there was what appeared to be a human figure laying supine in the snow. I'd say about 6 to 8 feet, kind of where the sidewalk met the front lawn of a residence.
What does supine mean?
So that he was laying on his back. From there, I made my way directly over to that individual and started checking for signs of life.
How do you check? Do you get close? Do you get down on the ground?
Yep, so I knelt right at his head. Typically, to check for any signs of life, it's just as you see in TV or anything like that. You check the carotid pulse, and you check for any signs of breathing or anything like that.
Where's the carotid pulse?
So the carotid pulse would be right in the neck. Like just real quick, 2 seconds, you can check either side. They're on both sides. Those are the strongest pulses that you can grab quickly. So I just real quick went right to that gentleman. Like I said, I looked for any signs of breathing. I found none. I checked a carotid pulse, and I found none.
How was his skin to the touch?
He was very cold to the touch.
He wasn't warm?
No.
So after you touched his cold skin and you felt the carotid, is it carotid artery? Is that how you
Yes, sir. Carotid artery.
Did you come to any initial quick assessments or conclusions in your mind?
So I found, like I said, I checked for signs of life, the carotid, the signs of breathing. I found none. From there, we had ascertained that there is no signs of life. As I was checking that, the other 2 individuals on the ambulance came and met me, and they began doing the same thing, just to check. I mean, sometimes you can look and you can miss. So the other paramedic, Anthony Flamati, started checking my work, and then we kind of went from there. But I found no signs of life in my initial.
So firefighter paramedic Flamati arrived to this person after you did?
Yes, sir. I was the first one to actually put hands on the individual and check for signs of life.
Did you later learn the name of this man?
I did.
And what was that?
John O'Keefe.
After you found no signs of life for John O'Keefe, did you get up and go to speak to anybody?
I did. So as being a second set of hands on the call, it's really not my call, like in terms of treatment modalities and how we want to progress. So after I found no signs of life, I kind of got up to kind of look around real quick. I went over to the individuals, the 3 individuals that were there, and just said, hey, I just have found no signs of life. We're going to see the next steps. And as I was saying that, that was when Anthony Flamati, who is the lead paramedic on this, made the decision this is a workable cardiac arrest.
Let me ask you 2 questions. The first is, as a paramedic firefighter, are there times when you're the lead paramedic on a call?
Yes, sir.
And so it changes call by call, but this one was firefighter or paramedic Flamati's lead?
Correct. He was the lead paramedic on this call.
There are other times when you're the lead and firefighter or paramedic Flamati is on your crew and you lead?
Yes, sir. So we typically switch off. We'll do one, and then once my rotation is complete, we'll do the next one. So it's patient for patient, typically.
When firefighter paramedic Flamati called you back and said it was a workable situation, can you explain to the jury what that means?
Yes. So in medicine, there is a term that is you're not dead until you're warm and dead. Meaning your core temperature, your core body temperature has to be within normal limits for it to be considered a futile attempt at resuscitation. Noting that, Tony, the other paramedic, Tony Flamati, realized that this gentleman was very cold to the touch and that this was now a hypothermic cardiac arrest, or a cardiac arrest in a hypothermic setting, which means as providers, we have a duty to initiate life-saving measures, CPR, ventilation, and continue those efforts until we get him to a hospital and a physician is able to take over and they are able to monitor his core body temperature for a certain amount of time.
I want to ask you about a term you used. You said a hypothermic situation. As a firefighter paramedic treating a patient at the scene, you're not diagnosing hypothermia, are you?
No, sir.
So you're not making a medical diagnosis, you're just saying it's a hypothermic situation because of why?
Just because of the conditions. He was extremely cold to the touch, and he was in the elements. We didn't know how long, so taking the fact that he is extremely cold to the touch and he had been outside for an unknown amount of time, that quantifies it to us as a hypothermic arrest or a cardiac arrest in a hypothermic setting.
Is there anything about Mr. O'Keefe's fingers or hands or his face that gave you any indication if he had been there just recently or had been there for a while?
His fingers were quite cold. They were not well perfused at all. They were very, very.
Mean? I don't know. What does not perfused mean?
Sorry, there did not appear to have been any blood flow at all. Just because he was, again, presumably being outside, his fingers were very, very white. They were very stiff, which can be signs of hypothermia and frostbite. And again, touching the neck. So typically, when you get cold, you kind of work back from your extremities in. So again, I noted his fingers were quite cold, but also when I checked his carotid, his neck felt quite cold as well. That just kind of tipped us back further down the road of a hypothermic cardiac arrest.
I see. When firefighter Flamade called you back,
Yep.
where did you go exactly?
So when I was told that this is what we're doing, I turned around and I went right back to where I previously knelt, which was right at Mr. O'Keefe's head. And then I took over the ventilation aspect of a cardiac arrest. So I was in charge of the airway. So I began giving him positive pressure ventilations with a bag valve mask, which is just a glorified balloon that you can push oxygen through and down into your respiratory tract to get oxygen moving. While I was doing that, I believe firefighter EMT Kelly had begun CPR.
So is this fair to say it's a team effort?
Yes, sir.
A coordinated effort?
Very much so.
And depending on where you're placed, whether in the back of the ambulance or driving or leading, does everybody have an important role to play?
Yes. Yeah, we work in conjunction with each other. Typically, the most well-defined roles in a cardiac arrest in EMS is your airway monitor, which was myself in this situation, and then your cardiac and medication administration, which is, that would be Anthony Flamati, that would be Tony. Just because of my position at the head, I just took over the ventilation aspect, and that was where I remained throughout the call.
You said you went back to try to help Mr. O'Keefe, and you were giving, helping at the airway. Do you have to actually get on the ground to do that?
Yes, sir. I was kneeling at his head.
While you were kneeling at his head, well, let me ask you more of a background question. Is it helpful to get information about the history of the person when you're trying to treat them when you happen upon a scene and you don't know the history?
Yes, sir, very much. Getting information on medications, history, and allergies is our top priorities in any call, not even this call, just really any your run-of-the-mill fall or chest pain. That's typically the first questions that we ask. What medications are you on? What medical history do you have? And do you have any allergies? Because if you've had heart attacks in the past, or just using a generalized example, if you've had heart attacks in the past, does this feel like a previous heart attack? Kind of gives us something to go off of.
As you were kneeling, I want you to take us to that moment. As you're kneeling, trying to help Mr. O'Keefe, did you have a chance at any point to look up?
I did.
And when you looked up when you were trying to help Mr. O'Keefe, can you tell us who you saw?
I saw a middle-aged male, middle-aged female. I hit him.
How clearly do you remember her words saying to you, I hit him, I hit him, I hit him?
I remember it very distinctly.
You've been to a lot of calls over the years and since.
Yes, sir.
Would you say hundreds or thousands?
Thousands.
Do you remember all of them?
I remember aspects of various calls, but not all of them, no.
Do some stand out more than others?
Yes, sir.
Did this particular moment stand out more as compared to your typical or most calls that you've been to?
It did, just because of the setting. I mean, it was the weather, it was the unknown factors, and it was the attempting to try and get information and not really being able to glean anything from that.
After the defendant said to you, I hit him, I hit him, I hit him, did you ask any follow-up questions?
I really didn't get a chance to, because following that, the individual just kind of walked away, or just kind of went in a different direction. I wasn't able to ask any follow-up questions.
Have you ever received any police training?
No, sir.
Are you a police officer?
No, sir.
When you're helping a patient, do you have any interest in detective work?
No, sir.
Do you have any interest in investigating potential crimes?
At that time, in this particular instance, because I was at the airway, that is a pretty critical aspect of a cardiac arrest. I was stuck there. I couldn't get up and kind of follow up on that at all. I was there doing that ventilation.
Is it your job to investigate cases or simply to get information to help treatment?
Just the information.
When you go out as a firefighter paramedic, do you have a purposeful cause?
Yes, sir.
And what is that?
To save lives.
And is that your only focus?
In this instance, it was attempting to restore circulation and breathing.
At some point with your colleagues, did you lift Mr. O'Keefe from the ground?
We did.
When you lift him, what do you put him on?
So we put him on, it's called a scoop stretcher. It's basically just a hard plastic moving device with some seatbelts on it, just to get the patient up and onto the stretcher, and then from there we can move from the stretcher to the ambulance.
After you lift him to the stretcher, tell us what happens next.
So we put Mr. O'Keefe on the scoop stretcher, and we were able to get him onto the stretcher itself and then off to the ambulance. From there, I maintained my role as the airway individual on this call. So we made our way to the ambulance. I got in the tech seat, which is directly behind where the stretcher locks in, so I had access to the airway again. I was continuing to provide positive pressure ventilations to Mr. O'Keefe, and we had put in an OPA as well, which is just a plastic hook, if you will. It just keeps the tongue from falling back into the airway, so we can continue to provide positive pressure ventilations. Once we got him in the truck and we continued that effort, we set up a suction system, and we prepared to intubate Mr. O'Keefe. We prepared a suction system just because as I was ventilating outside of the ambulance, there were some secretions in the airway that I could see, and you could kind of hear it as you go to squeeze in breaths into the individual. You can kind of hear the secretions kind of getting like bubbly and stuff like that. So we knew we were going to need to suction him. So we got him in the truck. We really quickly suctioned him, and then we were able to intubate him successfully to definitively give him an advanced airway and give him better ventilations, get more oxygen into his system.
Now, you mentioned that he wasn't warm, he was very cold.
No, he was still very cold.
What does the team do to try to assist with that?
The most basic thing that we did, we turned the heat on as high as it would go. We also stripped all of his clothing off, just getting all of that wet clothing off of him. I didn't really have a role in that particular part of it, just because once you're on the airway, that is kind of yours. Nobody can breathe for him, so every time I squeeze that bag, he gets a breath. So I'm kind of tied to that airway for the duration of the call.
So when your colleagues are stripping the clothes off him, is your attention on the clothes or more on the airway in your job?
No, I'm maintaining the airway. If an endotracheal tube is dislodged for whatever reason, it is typically more difficult to get one in. So the integrity of that tube staying where it is and not being dislodged, that is another key aspect of airway management.
As you're doing that, do you notice what any of your colleagues are doing to help?
Like I said, they were working on clothing removal. I believe they were also getting intravenous and intraosseous access on this individual to begin medication administration. But again, I was quite focused on that airway, just making sure that it was maintained and we didn't lose any tube. We didn't lose any end-tidal CO2, which is just another monitoring device that we use to confirm that that tube is in place.
How quickly do you get to leave the scene and start moving towards the hospital?
I honestly couldn't give you an accurate estimate. It didn't seem to be out of the ordinary realm, though. We were able to move within the flow.
In addition to Mr. Keefe being very cold, did you notice any other injuries on him?
So I noted that he had a hematoma right above his right eye.
Could you explain to us what that is?
Yep, it's just, for lack of a better term, it's just a big egg. He had a pretty good bump over his eye.
And you said his right eye.
Yes, sir.
Did you know how that hematoma was caused?
No, sir.
No idea?
No.
In addition to the hematoma above his right eye, what other injuries did you see?
There were also several scratches on his right arm, just below his shoulder, and traveling down his right humerus. They terminated right about his right elbow, just above it.
Those scratches, have you also described them as abrasions?
Yes, sir.
Is there any difference in your mind, difference between scratches and abrasions?
Nope. These were they were deep, and they were not bleeding, but they were notably deep.
Did you ever describe it as furrows?
I did.
And in describing those scratches, do you have any idea how they were caused?
No, sir.
Okay. And did you notice any other injuries on Mr. O'Keefe?
No, sir. Those were the only ones that we noted. As I mentioned, we suctioned a little bit of blood out of the back of his airway as well. I believe it was blood, mucus, and saliva. But those were yes, I did. I apologize. There seemed to be a little bit of matted blood around in his hair around there. Really didn't see anything too obvious at the time. He was also placed in a cervical collar as well, following intubation, and that was kind of there just to maintain his cervical spine. But there was, like I said, there was noted to be a little bit of dried blood on the back of his head.
At some point, did you finally make your way with Mr. O'Keefe to the Good Samaritan Hospital?
Yes, sir.
And just share with us what happens when you get there.
So after we got there, we handed off care to Good Samaritan Medical's physicians and ER nurses. We were able to give a report to the physician of just basic what we've done, what we've given for medications, in my case, what he was intubated with, and how he was being ventilated, how well he was being ventilated, and any other further pertinent information. Typically, we noted that Tony was the lead paramedic, so that is typically his. He kind of holds the room for a minute when we get in there and gives a big rundown, and then we back off and let Good Samaritan take over.
Okay. When the defendant told you that she hit him, did that have any significance to you?
No, sir.
Did it reconcile with the injuries that you saw before you that Mr. O'Keefe was suffering from?
No, sir.
And so at that point, was that information insignificant in perspective of your care?
Objection. Sustained.
Okay. What role did that information play in your care after the defendant told you she hit him? How did that contribute or not contribute to what you were doing?
It really didn't help at the time. Again, I wasn't able to chase anything down from that. I just kind of took it, noted it, and moved on with my aspect of the cardiac arrest.
Okay. Have you had an opportunity at any point to see any video of that morning taken from any source, police car, dash cam?
Yes, sir.
Okay. Your Honor, I'd like to introduce a video stream.
Okay. So this will be in evidence? There are agreements with some of the evidence already?
I believe there's no objection, but I don't want to speak for the defense.
There's no objection.
Okay, thank you. Yes, you can show it.
And for the record, if I may note, this is Cruiser 683 Stream 2. I'm sorry. It is Cruiser 683 Stream 2. I'm going to ask to play a portion of it that's relevant to Mr. Nuttall. Ms. Gillum, if you would please move to 6:11 a.m. Please stop the video. Mr. Nuttall, do you see the red lights reflecting on the left?
Yes, sir.
Do you know what those red lights are?
Presumably those would be ambulance 1.
Yeah, so not what you presume. Do you know what they are, sir?
And those are the lights for ambulance 1.
Do you see the weather conditions as it's depicted on this video?
Yes, sir.
Oh, as you stood outside, was it same or different to how it appears in this video?
That is the same.
When you look to the left, you see a straight line about an inch or two from the left of the screen. Do you know what that item is?
Sorry, sir. Repeat the question.
If you look to the left of the screen,
Yep.
you'll see a straight item from the bottom halfway up the picture. Do you know what that item is on
I
the
believe
video?
that's a flagpole, sir.
Do you see a little bit of movement of bodies near that flagpole?
At the present time, no.
Okay. Could we continue to play, please?
Yep, there they are.
Could you stop, please? Did you see the first person in line now behind the person with in front of the person with the blue hat?
I'm sorry, sir. Could you back it up like 10 seconds?
Certainly. Keep going, please. Do you know who that person is?
I believe that's me, sir.
Okay. Could you please continue? Is this your first assessment?
Yes, sir. This is ascertaining any signs of life or breathing.
Is that you approaching?
Yes, sir.
Could you stop, please? After informing your return, is that after firefighter Flamati called you?
So right after that, when I turned around, that was when Tony said, "Hey, we're working this."
Okay. Please continue. Stop, please. And do you see a person come over to where you are?
Yes, sir.
Is it at that point or another moment when the defendant said, I hit him, I hit him, I hit him?
It was right there, sir.
Could you continue, please? Could you stop for a moment? There's no noises from people coming through that audio. When you were there that night, throughout the event, was it silent or were people speaking? Did you hear people speaking?
There was, as I noted when I got out of the truck, there was quite a bit of screaming. It was quite chaotic. The wind was also a factor, but there were people around. They were speaking within themselves too, but there was screaming, there was wind, and there was different side conversations as well.
And when you were working on Mr. O'Keefe, were you having conversations with your colleagues?
Yes, sir.
They're not picked up on the audio?
No, sir.
Please continue. Sir, are you still at the flagpole?
Yes, sir. I'm kneeling at the head of the patient.
Are you included in that group of first responders?
I am not, sir. I have actually exited to the side with the bags. I believe I'm entering the ambulance at this point.
Okay. Thank you. We can conclude the viewing. With the court's permission, I'd like to approach and show a few exhibits to Mr. Nuttall. They've been shown to the defense.
Yes,
Thank you. May I approach?
yes.
Thank you. No objection. I'm going to show you a photograph.
Yes, sir.
Sir, do you recognize what's in that photograph?
Yes, sir. Those are the scratches on Mr. O'Keefe's arm.
Does that appear the same as when you saw his arm that morning, or is there any differences? And if there's any differences, can you share them with us?
That appears how they were to me at the time of the incident.
Okay. May I approach again, Your Honor?
Yes,
I'd like to introduce this as an exhibit, please.
okay.
Awesome.
I'm going to hand you a...
Hold on.
I'm sorry.
Thank you.
Pardon me, Your Honor. May we publish to the jury?
Yes,
Is that the photograph you just identified on the screen?
Yes, sir.
Showing you a second photograph, I'd like to ask you some questions about it.
can we take that one down, Mr. Brennan?
Yes, of course.
Please, Ms. Gilman.
Thank you. Does that photograph, do you recognize that area?
Yes, sir.
Is that the same or substantially the same area where you helped try to treat John O'Keefe?
Yes, sir.
Does that look to be a fair and accurate representation of the area?
It does.
With the court's permission, I would introduce this as an exhibit, please.
Okay, and there's no objection to any of these three?
None.
Okay, yes.
Thank you.
Thank you.
With the court's permission, could I publish exhibit 2?
Yes.
And sir, that's what you recognize as the area where you were helping to treat John O'Keefe.
Yes, sir.
I've left one last photograph in front of you.
Yes, sir.
And do you recognize that?
I do.
Tell us about any differences between when you were there and what you see in that photograph.
The street appears to be plowed. There's bare pavement. The weather conditions are significantly better. It is also daytime.
If we could take down that exhibit 2, Ms. Gilman. May I approach, Your Honor?
Yes,
I would move to introduce this as exhibit 3.
all right.
With the court's permission, I'd like to publish exhibit 3.
Sure.
Is that the photo you just identified?
Yes, sir.
Okay, we can take that down. Thank you. Thank you, sir. I have no further questions, Your Honor.
All right. Mr. Jackson?
Thank you, Your Honor. May I?
Yes, please.
Good morning, good afternoon, Firefighter Nuttall.
Good afternoon, sir.
Nice to see you again.
You as well.
Before your testimony this morning, how many conversations had you had with any member of the prosecution team in anticipation of your testimony today?
I believe it was 3, sir.
When were those?
I could not give you dates off the top of my head.
Give me a time frame. Within the last 3 weeks, within the last 3 months, last 3 days?
Within the last 3 weeks, I believe one the week after that, and then one last night.
One
Last night.
last night. What you did discuss, let's take them in order. First of all, who did you meet with 3 weeks ago?
I met with Mr. Brennan and his staff.
And when you say his staff, who else?
I honestly couldn't tell you, sir.
Mr. Lally?
No, sir.
Male, female?
One female, one I believe, state trooper.
Okay. Had you ever met State Trooper Tully previously?
Yes, sir. Actually, I believe that was him.
It was State Trooper Tully?
Yes, sir.
Whom you've met with several times, correct?
Prior to that, I believe only once or twice.
He was the one that he has formally interviewed you previously, correct?
I believe he arranged the meetings with Mr. Brennan, but
Okay.
Beyond that, I can't speak to.
What did y'all discuss 3 weeks ago?
The first meeting, going in order, it was mostly just kind of an introduction. I had not met Mr. Brennan yet. I really didn't know him. So it was mostly that, and then just kind of seeing where we were at with testimony, going over previous testimony and in that sort of realm.
Prior to today, how many times have you testified under oath concerning the incident on January 29th, 2022?
Once at a grand jury hearing and once last year.
All right. As a matter of fact, last year in this courtroom.
Yes, sir.
Okay. Did you look over your testimony at the grand jury 3 weeks ago during that meeting?
No, sir.
What about the testimony from last year?
We did go over the testimony from last year. Yes, sir.
Were there any issues that Mr. Brennan or anybody else in that meeting brought up concerning any of your testimony?
There was just a question of how many times the I hit him came up. It was 3 times.
And were you advised that that's not what you said at your testimony last year? You said it
No,
was
sir.
2 times?
What was that?
You said it was 2 times last year?
I honestly can't recall, sir.
Okay. But you just saw that, or you just read that and went over that 3 weeks ago.
I believe so, sir. Yeah.
But you can't remember, as you sit here today, just 3 weeks ago, what y'all discussed in terms of how many times you previously testified that you heard the phrase, I hit him.
So previously testified possibly to 2, but it was 3.
Okay. Your memory is clearer now than it was, for instance, a year ago when you testified.
Repeat that?
Sure. Your memory is clearer now, as you sit here, that it was 3 times you heard that, than it was a year ago when you testified that it was 2 times.
Yes, sir.
Okay. Does your memory get better with time generally? Your memory. I'm not talking about the royal you. I'm talking about you.
In certain settings, I mean, there are certain things about different aspects that I recall better than others.
Okay. And does your memory tend to get better, or does it fade over time? That's my question.
It can fade over time, but it depends on the context.
But in this case, you're telling this jury that your memory is better now than it was a year ago when you testified about the exact same circumstance, correct?
Yes, sir.
Okay. You then met about a week after that, which would be 2 weeks ago.
Yes, sir.
Who'd you meet with then?
The same group.
And what did you discuss at that meeting?
Again, just prior testimony, and that was really the gist of it.
And tell me the specifics of the prior testimony that you...
Again, it was the how many times we had talked about saying I hit him. Again, it was 3 times. And then there was also the video that was just played for me.
If I'll take the video in just a second. If y'all had met 3 weeks ago and you indicated to Mr. Brennan that it was actually 3 times, not 2 times that you heard the I hit him, why did you need to discuss it again a week later to verify the 3 times versus 2 times?
I'm not sure, sir. That was just the way that the conversation went. And I just, again, repeated what I said and what I remember from that morning.
Well, tell me about that conversation. Did Mr. Brennan say anything like, well, are you really sure that she said it 3 times?
It was that morning what was said to you. And I said, I hit him. That was how it went that morning, and that was how I remember it.
Okay. And did Mr. Brennan say, well, that's not consistent with how you've testified previously concerning the number of times you heard the I hit him phrase?
Yes, sir.
He did say that.
He wanted to he acknowledged that I had said it twice. However, again, as I mentioned, it was said 3 times to me.
So now you do remember last year that you only said you only said that it was repeated twice.
One more
Correct?
time, sir.
So now you do recall that last year when you testified today. Let me put it that way. Correct?
I believe I said I hit him twice on the stand last year.
Right. And if you're saying I hit him 3 times instead of twice, that, firefighter Nuttall, is inconsistent with your testimony today, correct? You
Yes,
agree
sir.
with that?
But that is how it went that morning, though, sir.
Okay, that's not my question. Let me see if I can do it again. So I'm asking you, if you testified last year
Yes, sir.
that you heard the phrase twice, and now a year goes by and you're testifying in front of this jury this year that you heard it 3 times, those 2 statements are inconsistent with one another, correct?
Yes, sir.
Okay. Did you talk at the meeting 2 weeks ago about any other inconsistencies with your testimony?
Not to my knowledge, sir.
Well, you were there, and you
No.
say not to my knowledge, meaning,
No, sir. We did not.
okay. So it was just about the number of times that you heard the phrase, I hit him, correct?
Yes, sir.
All right. You cleared that up in the 2 meetings, 3 weeks ago and 2 weeks ago. What did you talk about last night?
Mostly just making sure that everything was as it had been. I mean, and by that, I mean, it was 3 times, and that we were continuously making sure that everything was the way that it had happened that morning.
Everything was the way that Mr. Brennan wanted it to be.
No, sir. The way that it was in, I remember it, and I recall it happening.
Okay, so he asked you 3 weeks ago about how many times you heard that phrase.
Yes, sir.
You changed your testimony at that time and said it was 3 times instead of 2 times. We agree on that, correct?
Yes, sir.
Then he called you a week later, or met with you a week later, and again reiterated, making sure you stick with that testimony that it's 3 times, not 2 times, correct?
Yes, sir.
And then last night he called you just to make sure one more time you're going to stick with that testimony that it was 3 times, not 2 times, correct?
Yes, sir.
Hold on just a second. May I have just a moment, Your Honor?
Yes.
Okay. And when you talked last night, did you assure Mr. Brennan, nope, 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 when we come in tomorrow, I'm certainly going to say it was 3 times, not 2 times?
No, sir. I told him I would tell my recollection of that morning.
Okay. And did you tell him that what my recollection is, I'm going to tell the jurors it was 3 times that I heard it?
That was what I heard.
Okay. Did you tell him that's what you were going to say today?
No, sir.
You didn't?
I told him I was going to tell him what I remembered from that morning.
Which was what?
I hit him, I hit him, I hit him.
Which is how many times?
3 times, sir.
And that's inconsistent with what?
I believe a year ago.
Okay. Now, you also talked about, I want to get back to the other thing that you talked about. You said that at some point, either in the meeting 3 weeks ago, the meeting 2 weeks ago, or the meeting last night, you were shown a video.
Yes, sir.
Which one of those meetings were you shown a video?
I believe the second one.
Okay. Were you shown the entire video? Okay. What did y'all talk about in relation to that video?
Mostly nailing down who was who in that video.
Okay.
Being the other personnel on scene, where I was, and that was about it.
He showed you the clip that you showed. He showed you the clip that you've just seen on direct examination, correct?
Yes, sir.
Did you tell him where you were?
Yes, sir.
Did Mr. Brennan ask you to define exactly where it was that you supposedly heard this phrase, I hit him?
No, I was able to give that to him, sir.
Okay. And what you told him was that moment when you see my client walk over sort of to the left of the screen, correct?
Yes, sir.
And you defined, that's the point at which she said, I hit him, I hit him, I hit him.
Yes, sir.
And that's in response to your question. I want to make sure I'm clear about this. You asked, do you know him?
Yes, sir.
And she repeated the phrase 3 times, I hit him, I hit him, I hit him.
Correct.
Okay. We'll talk more about that in just a second. Did Mr. Brennan ask anything else about that specific video?
No, like I said, he kind of asked me to point out different individuals on the scene, and that was really the extent of it.
You saw that same video last year when you testified, correct?
No, sir.
You didn't see it last year?
Not to my knowledge, no.
In preparation for your testimony last year?
I did not.
Did you see it before your grand jury testimony?
No, sir.
Okay, so this is the first time that you've seen it.
Yes, sir.
And you were able to establish for Mr. Brennan exactly when it was that you believe you heard the statement based on your view about 2 weeks ago of that video.
No, that was the way that I remember it.
Right,
That
not
morning.
a trick question. My question is much more simple. You were able to establish after been 3.5 years now, exactly where you were and where Miss Reed was and who else was around at the time that you believe you heard those three statements in order. I hit him, I hit him, I hit him.
Yes, sir.
Okay. You testified last year as well that there is a normal protocol for removing clothing from a patient, and it's essential to just discard it and get it away from the patient so that you can concentrate on the life-saving measures that you're undertaking, correct?
Yes, sir.
That could be done you said in the ambulance, it could be done in the hospital, it could be done in situ, out there in the field, correct?
Yes, sir.
But the point is you want to get as much clothing off of the person as possible so that you can assess that person's physiology.
Yes, sir.
There's not really a lot of care taken to preserve the clothing from an evidentiary standpoint, in your view, correct?
And we're trained to try and, just to take example of a shooting, try not to cut through the entrance wound of the clothing.
Fair enough, fair enough. I mean, when you're literally trying to save someone's life, your job is to get the clothing off and get it out of the way.
Yes, sir.
You're not sticking it in an evidence bag and sealing the evidence bag, things of that nature.
No, sir.
So it might end up on the ground.
Yes.
Right? Might end up with some debris on it.
Yep.
Might end up in the floor of the ambulance.
Yes, sir.
Could end up in the floor of the hospital, or on the floor of the hospital. Is that right?
Yes, sir.
Okay. And if it's tossed in the floor of the ambulance, the clothing may well pick up debris from the ambulance.
Oh, yeah. Yes, sir.
Or the debris from the floor of the hospital or wherever. Is that yes?
Yes, sir.
Okay. You testified previously at the grand jury in April of 2022, correct?
Yes, sir. I believe so, sir.
Okay. So this happened in January of 2022, that same year in the springtime. You testified at the grand jury, April 20th, I think it was.
Yes, sir.
Does that sound right?
Yes.
Okay, I want to take you back to that testimony for a second. You testified at that hearing that Mr. O'Keefe was, quote, dressed appropriately for the weather. You remember that?
Yes, sir.
All right. It was obviously well below freezing at that time.
Yes,
That night that you responded.
it was.
We just seen the video. It looks cold as hell, right?
It was chilly.
All right. The wind was howling.
Yep.
It was snowing. Is that right?
Yes, sir.
And you testified that John O'Keefe, quote, had a heavy coat on and possibly 2 other layers of clothing.
Yes, sir.
In April 2024, you reiterated your very specific memory of and you even called it a puffy heavy coat that he was wearing, which was then removed so that you could assess his injuries, correct?
Yes, sir.
All right. Not to get too colloquial, but a puffy coat is like, it's got down and stuff in it, right?
Correct.
Looks kind of like Stay Puft Marshmallow Man, right?
Yes, sir.
Okay. Pretty distinctive article of clothing.
Yep.
And you testified last year that Mr. O'Keefe was wearing that clothing, which you had to remove or somebody had to remove in order for him to be properly assessed.
I did testify that way. Yes, sir.
Okay. And you mentioned that your memory of that big heavy winter coat was as clear as your memory of other specifics in this case, correct?
Yes, sir.
I asked you that exact question, didn't I?
You did.
And I said, your memory of him having that big puffy coat on, which stood out in your mind, was just as clear as the other specifics that you've testified to about the case,
Yes, sir.
about that night. And turns out you were completely wrong about his clothing, correct?
Correct.
Matter of fact, he wasn't wearing a coat at all.
No, sir.
He wasn't wearing a winter coat, correct?
Nope.
He wasn't wearing a heavy winter coat, correct?
Correct.
And he wasn't wearing a puffy, heavy winter coat.
He was not.
Yet you testified that he was wearing all of that, and that was clear in your mind at the time.
Yes, sir.
Did Mr. Brennan bring that up during the meeting 3 weeks ago?
He asked about what I had meant when I said appropriately dressed.
So you did talk about something other than just I hit him, correct?
Yes, sir.
When I asked what y'all talked about, why didn't you tell us that?
To be perfectly honest, sir, I did not remember until right now.
So your memory is fading even after 3 weeks.
Yes, sir.
Got it. The fact is, well, let me ask you a different question. Did Mr. Brennan tell you what Mr. O'Keefe was actually wearing?
No, sir. Actually, I believe you did.
Last year, didn't I?
Yes, you did.
It's a short sleeve T-shirt and a little thin wool hoodie, right?
Yes, sir.
Wasn't wearing a hat.
No, sir.
Wasn't wearing, as a matter of fact, didn't even have a shoe on, correct?
Not to my knowledge.
And obviously, goes without saying, but I'm going to ask it anyway, that's not being appropriately dressed for the winter.
No, sir.
Yeah. You indicated that you did notice certain injuries on Mr. O'Keefe's person.
Sir.
Once you got him back in the ambulance, obviously it's lighter, meaning brighter lights. You have more equipment in the back of the ambulance. You can better assess somebody's well-being, correct?
Yes, sir.
And you indicated you had a, quote, much better picture of what we were dealing with, correct?
Yes.
You noticed once in the back of the ambulance that he had trauma to the right side of his head.
Correct.
And as a matter of fact, when you were pointing at it, I'm doing that on purpose because you pointed to the right side of your sort of forehead above your right eyebrow, correct?
Yes, sir.
Okay. The majority or the worst injury that Mr. O'Keefe suffered was actually to the back of his head, which you indicated, you noted was quite matted with blood, correct?
Yes, sir.
I want to talk about the injury to the right side of his head as distinct from the back of the head injury for just a second. Before I get to that in detail, let me ask you, because I just sort of want to cover the bases. You noted the back of the head injury, correct? Is that yes?
Yes, sir.
You also noted the front right side of the head above the right eye, correct?
We did.
You noted some injury to his eyes. They looked blackened.
Yes, sir.
But primarily the right eye was blackened?
Yep.
And there was a golf ball size egg, I think you put it, over his right eye,
I did.
often called a hematoma.
Correct.
And you also noted when you got his shirt off that he had scratches along the right side of his arm. Is that right?
Sir.
You indicated on direct examination today that you believe those scratches ended where? Meaning from top to bottom? And I'm not using anatomically correct
No.
language. So from shoulder to wrist, where were the scratches that you noted?
There were several. As I noted, they were on his right humerus area.
Tell me what a humerus is.
The right arm.
Biceps.
Right about here.
Okay.
No, a little further, like between where your bicep and your tricep kind of meet. Right,
Got it.
Right about in there.
Okay. And what did the scratches look like?
They were deep, infamously referred to them as furrows, but they were quite deep. You could tell that there had been some material removed.
Okay. Material meaning skin and flesh.
Yes, sir.
Okay. Some biological material. Mm-hmm. Is that yes?
Yes, sir.
And were they parallel? Meaning they were going in the same direction?
Yes.
Were there any scratches below the elbow as
There
well?
were. Yes, there
Okay.
were. They were not as significant as the ones on the upper arm, but they were noted.
Okay. And those were parallel as well?
Yes, sir.
And they looked like scratches to you. That's how you described them?
They did.
Last year, when you described those scratches, you curled your fingers up, exposing sort of the nails, and drew it across your biceps. Is that what you were using to describe what the sort of scratches looked like?
I just kind of used that as a landmark, to be honest with you,
Okay.
sir. It was just kind of how I quantified it in my mind.
Okay. But what you did was you did this motion.
Yes, sir.
As you said, there were furrows. And remember, there was an embarrassing moment for me.
Both of us, sir.
I couldn't understand the word furrow because of the accent, right?
Yes, sir.
All right. Let's talk a little bit about the hematoma above the right eye for a second. That's basically damage to subdural blood vessels that causes acute swelling, right?
Correct.
And a very common cause of a hematoma over one's eye could be being hit or punched in the face. We talked about that.
There could be several causes for hematoma, such as that.
Obviously. I mean, it could be a golf club, a baseball bat, or it could be a fist.
It could be.
Okay. We talked about that last year. I asked you if the injuries that you saw on Mr. O'Keefe's face, including the laceration over his right eye, was consistent or inconsistent with a physical altercation, and you said it was consistent with a physical altercation as well.
Excuse me?
Objection to referring to past testimony before a question is asked.
So sustained.
Sure. Do you remember a laceration, in addition to the hematoma, about a 0.8 centimeter laceration over his right eye?
I do.
Tell me I'm using a word that maybe not everybody understands. I didn't understand it when we first started this thing. What's a laceration? What's the difference between that and a cut?
A laceration is they're basically the same thing. A laceration is just a deep cut.
Okay. So it's a parting of the skin.
Correct.
In other words, where the skin separates.
Yes.
And that can be from blunt force trauma, meaning something hits it rather than cuts it.
You can get
Sustained.
What are some of the causes of lacerations?
a laceration, as you noted, blunt force, but you can also get a laceration from a slashing movement, from a stabbing. I mean, that is still a laceration.
What about a hematoma?
That is primarily caused by blunt force trauma.
Right. And the hematoma and the laceration were right next to each other, correct?
Yes, sir.
Okay. And you indicated last year, or let me ask you this way. Is that consistent or inconsistent with a physical altercation?
Objection.
Can you answer that?
I could not say, Your Honor.
Okay, next question.
Well, last year, you indicate you can't answer that. Last year, you did answer it, didn't you?
Objection.
So I need to see counsel at sidebar for just a minute, please. Mr. Nettle, we are going to let you take a break and come back and join us after the luncheon break. So this is
Sounds good.
the luncheon break. There's lunch here for you. I assume, Tony, is it here?
It is here.
Okay. There's lunch here for you. We'll see you in about a half an hour.
All rise, please. Jurors, leave your notebooks on your chairs.